Welcome to Foundation 96, Conversations about Healthcare After Cancer Treatment. My name is Lisa Capamagian, and I'm very pleased to be hosting our first ever series of conversations. Karen Anderson from Foundation 96 is joining us today. She's the Managing Director, the founder, and also a health consultant. We're joined by Jennifer Martin, a physiotherapist from Dynamic Physio and Wellness, Adrianna Marshall, a senior exercise physiologist from Ballycara Wellness Program, and Janet, a Foundation 96 client. Welcome, ladies. Thank you for joining us today. Now, Jennifer, I understand that you have to leave us a little earlier than expected. So how about we start with you and you give us an overview of how Dynamic Physio and Wellness supports people post-cancer treatment.
I am the owner of Dynamic Physiotherapy and Wellness. It's a little physiotherapy clinic in Tugun on the Gold Coast. Maybe 3 years ago, I won a scholarship with the Pink and Steel International Foundation to do further training into cancer rehab specifically. So I completed that just before opening here, really. I have been seeing various patients with cancer of all different types of cancer, mainly breast cancer, but also lots of men with prostate cancer, lots of blood cancers, young people, older people. It's quite broad, really. I have a little clinic here with Pilates equipment, and I do very small classes and one-on-one sessions with people specifically to restore their movement after they've had surgery or are going through treatment.
What is the key thing that you think is different from treating someone that, has a standard musculoskeletal, issue as opposed to someone who has the same issue with cancer?
I try to have more of a personalised approach. I think cancer is something that happens to you, but it doesn't really define you. I think some people initially it defines you while you're in the throes of being treated by it, but then sometimes you sort of forget yourself a little bit because so much of your life is consumed by your cancer treatment.
Jennifer, tell me how you've had to adapt your current service provision for people specifically who are either undergoing cancer treatment or a post-cancer treatment compared to, someone else who might come along with the standard musculoskeletal issue.
I guess I've undertaken the extra training just to think about the other side effects that are happening from their cancer treatment, being able to have shorter sessions on the days when they're quite fatigued. There's certain parts in your treatment where you physically just can't be out and about that long. It'll just be exhausting just to get to treatment. Working on having wherever the patient is in their journey, trying to adapt the sessions to that. So shorter sessions if they're right in the middle of chemo, longer sessions as they're getting their strength back, working on the side effects that come from their treatment. I think there's lots of extra side effects that occur that you are not really consciously aware of as you're going through treatment, and you're not made aware of because it's sort of, you're overwhelmed. Your medical experts try to give you just the information that you need and nothing more at the time because it's quite overwhelming. And they may have actually told you those other things, but you're focusing on what's in front of you and you tend to not worry about those other things until you're a bit further down the track, and then you realise those parts of your rehabilitation haven't been addressed yet. Yeah. So then we work through the client's goals, where they're at with their treatment and where they want to be in the future.
Can you give us an example of where your therapy can in particular help people who are experiencing the side effects?
I have been treating one lady in particular. Has travelled up from Byron Bay basically to have her treatment at the John Flynn Hospital here because that's the closest major hospital for her. So I've seen her from the outset of her treatment. She's had a lot of extra things like, say, blood clots, infections that have happened with a portacath. Then she's had radiation, then had severe burns, which have happened after treatment. I think a lot of people feel like all of the symptoms will occur during treatment and then they get that latent response where down the track, they actually, after they've finished the treatment, they actually get those burns come out a few weeks after they've actually had their radiation. So then that sort of affects whether or not you can actually touch them around that area, whether they can even sit in a chair and have any contact with those areas of their burns. And then I guess she developed then a lot of scarring around where that radiation was and wasn't able to then, she lost the movement in her arm. She then got her arm range back, but then went back to playing with her grandchildren, and then tore her rotator cuff, and then started to develop frozen shoulder. So one thing can lead to another, but it all has really started from the cancer treatment, I guess, but little bumps can continue to pop up and make your treatment a lot longer and your rehab a lot longer than you had anticipated. She's looking fantastic now. All her hair's grown back. She's got most of her strength back. She's back swimming in the ocean, which is what she loves. And she's moved to the Gold Coast because she loved it here so much during her treatment. And we're also working on building up her stamina and her strength now, so she can go back to her ocean swimming and start to compete in that now more so than rather than just doing it recreationally. So I guess I've seen that particular lady probably at her lowest point physically and mentally, and then now she's flourishing and is strong and fit and healthy and competing in high level sport. I did find the overwhelming feedback from patients was once you finish treatment, once your medical treatment is done, they wipe their hands of you a little bit and say, right, we've done everything we can for you, now go. But there is no real hub to go to find that information. So there's lots of different specialists of different areas, but there's not too many places that actually bring that together for patients. Like, it's really, really important that the message sort of gets out to people that your rehab and your returning to yourself doesn't happen as soon as your treatment's finished medically. I think most of the gold comes after that. That medical component is to keep you essentially alive, and then the rest is to get you back to who you were or who you want to now become, because I feel like that changes once you've been through cancer. It makes you reevaluate your life and what you value and what's important to you, and then you might find that what you used to love or think was a really big deal is probably not so much anymore, and you find you're a bit more insightful and you look for different things, and it's important to have lots of areas of your life fulfilled, like psychologically, physically, emotionally, even sexually. There's a lot of, lots of people don't really talk about what happens to women's bodies after most of those things. Are sexual organs, if you have any breast cancer, any, uterine cancer, cervical cancer, any of those, bowel cancer, anything, it's really comes back to that part of you that makes you you, but you lose that a lot. And I find there's lots of non-information that's very hush-hush, like let's just pretend that didn't ever happen to you. And I think there needs to be more open discussion so that people feel welcome and ready to ask the questions that they want to ask.
That's a very good point. And I think, Karen, that could be a very challenging and interesting topic for discussion another time.
It is. I mean, we've got a number of therapists that specialise in sexual, as in the therapy physically, and then we have other therapists that are looking at it on a psychological basis. So depending on where the person is on that time. But we've had some good conversations about it, and it is starting to not be as taboo. So, yeah, well done, Jennifer, on that one.
Yeah,
yes.
Thank you.
I do find there's lots of different moments in your path too. Like sometimes you don't even want to talk about it. You go, that is the last thing I'm thinking about. And then other times you're like, I wish someone had just asked me that question. And then you sort of can broach it. But it's, so it's different for every person, but it is still a part of you that should be at least considered, I think, and have the avenue to know where to go to seek services for that.
I mean, especially the prostate guys, the prostate cancer guys are the ones that we always have to try and flag and make sure that they're getting the knowledge that they need, because it is that masculinity and they don't have a voice as strong as women. They tend to keep that to themselves. So we don't need to just focus it on women. I think we always have to keep this as a male-female conversation too.
Good. Well, thank you very much for your time, Jennifer. I really appreciate your insights and your time to contribute to this session today. Thank you.
Thank you.
Bye, Jen.
Bye.
Janet, would you like to tell us a little bit about yourself and your lived experience with cancer?
Just as Jennifer was saying, post-treatment, I've been harassing my oncologist for a long time saying, where can I get some help? So I just couldn't find anybody who understood. I'd go to a different physiotherapist and they go, oh, yeah, no, it's just your shoulder, blah, blah, blah. And I go, well, actually, it's not. And so to find Karen, who has then found me the wonderful Jennifer, who, the minute you walk in, you just know that this woman has A, got your back, and B, knows exactly what you're going through. And interestingly, listening to her speak, it was almost like she had been down that journey herself. She was so well aware of, the difficulties that come in that place you're in. So I was searching, and I found Karen. She straight on board and on my case. And before I knew it, I had a physiotherapist, I had a massage therapist, and I had a exercise physiologist. So, I just wished I'd found her a long time ago.
That's fantastic. So where are you at in terms of your program at the moment?
I've only just started with Jennifer, and in actual fact, I've only had one hands-on treatment, and it was terrific. It was non-invasive, but you just seemed to get a result that the pain sort of went away without a lot of effort on my behalf or her behalf. She just seemed to understand. And how she explained it, I'm quite complicated with the issues I have. And she said, look, it's just unraveling the string. We go back one bit at a time, and then we get to, the end, and it works. With my exercise class with the lovely Adrianna, I think I've been 3 or 4 times, and that's a circuit program. We're all over 65, all lovely ladies and men, and Adrianna's just a ball of fun, and it's just comforting to know that what you're doing is being sorted by someone who understands the issues that you have, A, at this age, and B, on the from the health spectrum. So it's really comforting, and it's fun.
That sounds like a great outcome. Adrianna, would you like to add anything to that from your perspective and working with Janet?
I think that's just the creme de la creme, really, to hear that it's fun. That's, my aim as a practitioner. You can know all the information, you can have all these stats, you can have all this information, but at the end of the day, if it's not fun and enjoyable and the people that are there not getting anything out of it, then what's the point? So as a clinician and everything, I think that's just what we should all aim for, is that you're having fun, but you also feel like your needs are being met, which I definitely think by the sounds of it, Janet, sounds like it is.
And Karen, what was your approach with Janet?
I mean, it's about giving her that opportunity to be able to tell me, this is what's happening with me currently at this stage. So then we look at that goal, we set 4-week goals, and then look at what's the priority and who do I then need to find to be able to link her in. So it's all personalised. Every single person is different. And we went in too early with one of the practitioners and realised that wasn't the best way to go. And so we changed direction and went into another direction. And now we've got a third practitioner that I'm sourcing at the moment for Janet. So, I mean, I love the fact that we can match the right people with when the right time. I think that's the most important thing.
That's great to hear. Janet, how have you found the process working with Karen when you first made contact?
She's just so well versed in so many aspects of the whole health issues that people in my position have. She's so easy to talk to. She is so knowledgeable. We enjoy talking to one another, but at the end of the day, she sets targets for me, and she gets the whip behind my ear if I don't if I don't meet them in a very nice way. So I feel extremely fortunate to have found her, to be honest, because I realise that's who I've been sort of searching for. One person is actually giving me all the different areas that I've been looking for a long time. So I'm very, very happy and delighted.
And do you think having that person that can give you that guidance but also hold you a little bit of accountable to following through is making a difference?
Absolutely. I think we all need someone perhaps to mentor us, and I certainly feel like Karen's been doing that for me. There's no question off limit. You know, everything is doable. She's got your back, and that's a really nice thing to have. And yeah, I really do feel very fortunate to have met her.
Thank you. And is there anything else that you would like to say to anyone else who's potentially thinking about engaging with a health consultant or a coach to support them through their post-cancer treatment?
I would recommend it wholeheartedly. I think it's, no matter what sort of cancer you've had, we all have the same need in terms of, we've all had surgery, we've all probably had radiation, we're all still suffering from chemo brain, and it's like having, I can't think of the right word, but to me it's just really comforting, and it's not until you find this help that you realize how much you've actually really needed it. I would recommend it to anybody who's either beginning, halfway through, or at the end of their treatment. And I just think it's fantastic, and it's Australia-wide, it's worldwide, so it doesn't matter where you live. There's someone that Karen's got that can help you.
Hey, Adrianna, so tell us about how you actually came to find Foundation 96.
Well, it kind of fell into my lap. I was quite lucky, to be honest. I had an email inquiry from Karen, asking a little bit more information about some of the classes we were running. And so I saw Foundation 96 and I've gone, what's that? Had a little look, and it was amazing. Just on the one click, you go on there and you can see all these providers and everything. And so I was like, definitely, I would love to be a part of this. Ballycara are a small not-for-profit organisation on the Gold Coast. Our head office is up in Redcliffe and Scarborough area, and we're a sub-branch. So we're quite a small, very small team, and there's only 2 of us. We're very close-knit. And then so seeing something like Foundation 96 that aligns with those values that we all hold within our community, it was pretty amazing. So I reached back out to Karen and we had a really good conversation. We talked about exercise physiology and the benefits, which is also really quite heartening because often we get mistaken for physiotherapists. Everyone assumes we're the same, and sometimes as an exercise physiologist, being a new profession as well, you don't quite get that clout and that, we need you in your arsenal of care. So it's actually really nice to be in this position where people know your worth as an exercise physiologist, which I'm really grateful for as well.
In terms of working with clients going through cancer treatment or after their cancer treatment, what are some of the things that you need to, take into consideration when you're developing an exercise plan for them?
I think, like we've all touched on in all of our answers, that everything is so individualized. You cannot have a cookie cutter plan for everyone. You have to, sit down, and I really believe in the whole biopsychosocial approach. So yes, I, know everything physically, I know how to do exercises and those things, but there's no point just looking at someone in their physical capabilities. You need to look at the whole picture. And it's not just our physical limitations, there's emotional limitations, social limitations, and all of this kind of encompasses into what we would like to call wellness. So as in the wellness program, we always at Ballycara pride ourselves on the fact that it's not just your physical journey and your physical health. We really want to encompass absolutely everything. And so especially with cancer, like we've all been saying, you have to notice that one person's fatigue looks very different to someone else's fatigue. Somebody's stiffness in their upper limbs look very different to someone else's. So you really got to learn to adapt and I think use your skills to try and make that program the best approach for everyone you can using the information you've got.
Excellent. And while we're here, would you like to give us an elevator pitch as to what an exercise physiologist is for those of you who don't know?
Oh, I love it. Well, essentially an exercise physiologist is an allied health professional, university qualified. They work across your lifespan. So we generally treat chronic conditions such as your heart disease, your diabetes, cancer, all of those conditions that you experience across the lifespan in comparison to a physiotherapist who is more in tune with your acute needs, like your rolled ankles and those kind of things. So more long-term. We specialise in behaviour modification as well. So that's another thing that I think helps sets us out, that we really work on trying to make this all self-managed and self-progress. We give you the information and you the skills to help with your health and wellness journey and take a bit more of a hands-off approach.
Your sessions, are they face-to-face at home? Do you do any virtual sessions? What's the format for your service?
Essentially, on the Gold Coast, we are a mobile service. So we offer one-on-ones and they are in-home. We also do offer telehealth. We also like to have a variety of group classes. So we range all the way from Pimpama down to northern New South Wales and the Benora Point region. And we have 2 different types of group classes. So we've got, as Janet mentioned, our circuit classes, which is in a lot of the community centres all through the Gold Coast and northern New South Wales. Essentially, we all get in there and it's a circuit-based activities such as that work on your balance and your aerobic capacity and your strength, and it's very social. Lots of cracking the whip to get them all keeping on going, and then some games at the end. And then we also offer hydrotherapy as well. So in the warm water, very similar concept, doing lots of different exercise in that social setting, which in my opinion is the best part of my job. And I think it should be part of any person's rehabilitative journey, because we can't underestimate the impact of social, gatherings, especially in the current climate we're in.
Karen, just to round it out with you, what do you do on a day-to-day basis?
Yeah, so people are contacting us and they're trying to find the solutions like we just had with Janet. So this is the side effects I'm experiencing, this is the treatment I've had, and then we're going to try and look at what is the top side effect that is actually that problem for that 4-week period. And I think what I enjoy from it is to, 1, know that I've got the people that can help, and 2, that the connecting the people together, to me, it's extremely exciting. They have a choice where they can come in and just do 1 hour. So if it's just a fairly, I need to find that particular person, it's not a complex situation, then they can just do it for the hour. If not, like we did with Jana, is the wellness plan, which is over 6 months. Because especially when we start to look at the hormone replacement therapies, they're lasting for 7 years. So it changes every 4 weeks. We get a different set of things. Janet's definitely experiencing that. We move through and then we get to the next set of goals. And it's about that accountability. It's really easy to see someone else's problems on the outside because people are living what they're going through. I say that they're just focusing on what's happening each day. But for me to have a window, especially when I don't know someone, the window of all of the things I can see you need to do, and I can actually make it happen. I think that's probably what makes my job very special.
It sounds like you develop a real partnership with yourself and the clients, and also with the other service providers that you're working with.
So I've been listening to this since 2000 and before, where I wish, as Janet said, I wish I could have found you. So I'm still on this mission to make sure that in cancer treatment, Foundation 96 is going to be part of a normal service. So no one has to come looking for it. So as soon as you've had radiation, surgery, hormone replacement, whatever chemotherapy is going to happen, then we're going to be there to support you when the time is right. And I think that's the key message. There's so much information and you are so in the side effects and the treatment that you don't know which priority to put them in. So that's my job. I put them in a priority and look at the most urgent first, and then we start to just knock it off. And it could be Janet and I might meet up in 5 years' time or 6 years' time, because there might be another lot of problems that she needs those solutions for. And as our directory keeps growing with so many service providers and not just health and wellness now, so we're starting to get lots of products that can help. And that, I think, is going to be our next sessions of where we're going to start to go when, Janet might say, I need to know where a wig, or I need a headscarf, or I need a nipple tattoo. I can find all those things now. So it's important that it's going to become a one-stop shop. And then if we can get that message into treatment centre, no one has to go looking. Because I, as a person that spends time on Google looking for things, I worry about trust and I worry about qualifications, and I'm nervous about whether this person's legit. So if I can take that away from that fear or that uncertainty, if I can take all that away and make sure that everybody that's in Foundation 96 has got those things, then I believe that the people that I'm going to link them to in the consulting part are going to have the best service they can have.
That's a very good point. Janet, from your perspective, was trust a big factor for you in making the decision to work with Karen and Adrianna?
Not so much trust. I had read Karen's webpage, and my initial thought was, oh my goodness, this woman, I wonder where she is. I bet she's not in Queensland. She's, ticking all the boxes in terms of what she was providing, what the experience she'd had overseas and in Australia. She had my trust from day one just by where she'd been and what she'd done. With Adrianna, Karen had found Adrianna for me, and she said, look, I really like her energy. The minute you walk in, Adrianna's just got a great big smile and an interesting program each time. It's not the same circuit. She'll do different things each week. And whoever she'd found for me, I would be, happy to go down that track. I had found practitioners before, and I was happy with them, but they just needed that extra amount of experience with people who'd been down this road. I think it's unfortunately it's unique, but many people suffer, not having access to what they need when they're wanting to get their life back and wanting to get rid of the issues that come with surgery. But also I think Karen mentioned hormone replacement. It's hormone therapy to stop your hormones. And that in itself creates, lots of issues for you health-wise as well. So it's just an ongoing, you need a solution. You've got an issue, you need a solution. And so no, 100% trust from day one.
And Adrianna, from your perspective, working with someone like Karen, who was able to, provide you with, a care plan and background information about Janet's condition from a therapist's point of view, how important was that to part of your care planning?
Extremely important, because unfortunately, you just don't get it all the time. You get the name of somebody, they want to come visit, and you get the name, you get maybe their date of birth, and maybe if you're lucky again, you get a very, very brief medical history, and then that's it. And you kind of, you don't even get a contact number sometimes to give them a call. And so, it can be quite difficult. So actually getting that information and coming, getting all this information makes my job easier to give such a better service. And I think that should be the gold standard, really. I think every health practitioner, any health and wellness needs to have that standard, because unfortunately in the area that I work in, there is not always that trust with health and wellness. Some people state, things that aren't quite evidence-based, and, that just takes away from myself and Jennifer and others who are very evidence-based. So yeah, I really do appreciate it, getting that information, because it just makes not only my job easier, but it makes what, in my opinion, my prescription and everything so much more valuable, so much more accurate, and so much more tailored for the individual.
That's brilliant. Karen, is there anything else that you would like to finish this session with?
It just warms my heart to know that my dream for the last 5 years is coming true. That if I can make every health and wellness business successful, that means I've helped so many more people that are living with cancer.
Yeah.
That's our direction that we'll keep moving towards.
Excellent. And Karen, just to reaffirm that you can deliver your service anywhere in the world via phone or via Zoom, for example.
Yeah, we're in 15 countries now, which is exciting. And I always love to watch that keep building. And we're nearly up to 800 listings. So we're going to keep the listings coming through. I mean, I have a lot of people that you'd probably be surprised that I don't let on. So I get a number of people that want to be part of Foundation 96. And when we go through the system and we check them out and we tick the boxes with their qualifications and their websites and their business and the experience and their certifications, that they don't become part of our business, and that is sad. And what I have done is I've given practitioners like Pink and Still that Jennifer was saying, and massage therapists, I've been able to give them places where they can up their certifications and then get back to me once I've done that. So it's, I suppose, it's my reputation and it's Foundation 96 credibility to make sure that we keep it to that standard.
Brilliant. Thank you. Thank you for joining us today. We hope you found our discussions as interesting as we did. If you'd like to know more, please visit foundation96.com. We'll see you soon.